Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top health news. ICMR in its recently released dietary guidelines has said that repeated eating of vegetable oils may increase cancer risk. The Indian Council of Medical Research has issued new guidelines highlighting the dangers of repeatedly heating vegetable oils. This practice, common in both households and commercial establishments, can lead to generation of toxic compounds that significantly increase the risk of cardiovascular diseases and cancer. The ICMR, along with the National Institute of Nutrition, released 17 dietary guidelines aimed at helping Indians make informed food choices to maintain good health and prevent malnutrition. The guidelines emphasize that repeatedly heating vegetable oils results in the oxidation of polyunsaturated fatty acids, producing harmful substances such as trans fats and free radicals. Trans fats are particularly dangerous as they are linked to an increased risk of heart disease. Additionally, reheated oil can release acrylamide and aldehydes, which are associated with cancer and other chronic diseases. To mitigate these risks, the ICMR recommends using vegetable oil only once for frying and then filtering it for curry preparations, consuming it within a day or two. To promote better health and flavor, using fresh oils and maintaining proper cooking temperature is advised. To combat quackery and ensure patient access to verified healthcare professionals, the center is issuing digital doctor certificates with QR codes under the Know Your Doctor service, part of the Ayushman Bharat digital mission. This initiative mandates that all verified doctors display these certificates in their clinics, allowing patients to easily verify their credentials by scanning the QR code. According to media report, around 139,000 doctors have already been verified and received their certificates. However, over 2 lakh nurses enrolled under the National Health Digital Mission are now still awaiting their certificates. Approximately 76.56% of registered medical professionals are from the public sector. The verification process involves state government appointed verifiers or state medical councils, after which the certificates are issued. The QR codes on the certificates aim to eliminate the issue of unqualified practitioners. Displaying the QR code prominently in clinics enables patients to confirm the legitimacy of their doctors. 1 in 3 Covaxin takers reported adverse events according to BHU study. In light of growing concerns about COVID-19 vaccine safety, a comprehensive 1-year follow-up study by Banaras Hindu University researchers sheds light on the long-term effects of Bharat Biotech's Covaxin. The study aimed to assess adverse events of special interest among vaccine recipients, providing crucial insights into the vaccine safety profile. The study included 635 adolescents and 291 adults, revealing that nearly 1/3 of the participants reported AESI. Among adolescents, common AESIs included non-onset skin and subcutaneous disorders, general disorders, and nervous system disorders. In adults, the prevalent AESIs were general disorders, musculoskeletal disorders, and nervous system disorders. Serious AESIs such as stroke and Guillain-Barré syndrome were reported in 1% of participants. During the follow-up period, nearly 50% of the 926 participants experienced infections, mainly viral upper respiratory tract infections. Menstrual abnormalities were observed in 4.6% of female participants, while ocular abnormalities and hypothyroidism were reported in 2.7% and 0.6% of participants respectively. 4 deaths were also reported among adult participants, all of whom had diabetes and 3 had hypertension. 2 had a history of pre-vaccination COVID-19. Stroke was the main contributor to 2 deaths, while 1 fatality was due to post-COVID-19 rhinocerebral mucormycosis. The 4th death involved a woman with multiple episodes of unconsciousness post-vaccination, with the cause remaining unidentified. The study emphasized the need for extended surveillance to understand the long-term outcomes of AESIs and called for larger studies to investigate immune-mediated phenomena following COVID-19 vaccination. Kerala girl taken in for finger surgery, doctor operates on tongue mistakenly. A doctor at Kozhikode Medical College in Kerala performed surgery on child's tongue instead of her finger. He was suspended after the incident sparked a controversy. The girl was admitted for the removal of her 6th finger. However, upon coming out of the operation theatre, the family was shocked to discover that the operation had been performed on her tongue. The parents alleged that when questioned, the doctor claimed that a cyst had been diagnosed inside the mouth, necessitating tongue surgery. The family refuted this, asserting there had been no issue with the girl's tongue and condemning the doctor's negligence as shameful. A family member stated that hospital authorities informed them it was a mistake and surgeries for 2 children had been scheduled on the same date. The incident sparked outrage in the state, prompting Health Minister Veena George to suspend Dr. Bijohn Johnson after receiving a report from the Director of Medical Education. The minister had issued strict instructions for hospitals to adhere strictly to surgery and other medical procedure protocols. The police case was filed against the doctor based on complaint from the girl's family, citing IPC section 336 and 337. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.